right, today I thought I would talk about another aspect of phone etiquette, kinda, but this one has to do with the patient that said, I'll think about it, I'll get back to you, now's not a good time. I don't know, we do sales training with our clients, so we take up all these different statements that they make and turn them into appointments. But let's say you missed and the person says that to you, and about a year later you go, hey, how come we haven't seen her yet? It's time for her next appointment, and she hasn't gotten back to us on the procedure that we presented. And I don't know, when you have a really busy practice, this is where the cracks are, and this is where a lot of income is actually lost, is these patients that go, for dentists, they have one where the insurance company has to be consulted first and give approval. And so sometimes that can take, in some provinces, it can take up to 2 weeks before you get a reply. In fact, one, it takes, I forget which province it is, Saskatchewan or Alberta. Anyways, it can take up to 8 weeks from one particular insurance company to get an answer back. So, so the patient goes off into Never Never Land, the staff are super busy, and they forget about this. And this is your biggest loss of income. This is the best way, if you have a few cancellations happening, you need to fill up your book, get out that list of people who should have gone ahead, who didn't go ahead, and see if now is a good time for them to come in. In fact, make now a good time for them to come in. Take the opposite viewpoint, and find out what is happening and so on. I'll be very truthful about one dentist I saw that I decided I was never going back to, and her staff to this day, about 4 or 5 years later, still call me. It's time for your, call me or text me. Worst thing is they text. They don't actually usually follow up. But one time she did, and I said, oh, I'm just really busy at this time, and maybe in a couple of months, so just follow up with me then, which she didn't, except for a text. Texting is not the way to follow up. One time, okay, they didn't answer that, okay, now we get real personal and caring. You have to get into the caring thing. You're not trying to get them to come back so that you can make more money for the office, or that the staff are happier, or the doctor's happier. You're doing it to make the patient happy, to keep them in good care. So whatever profession you are, and you have animals, if you're a veterinarian, and they need their vaccinations when they need them and so on. And the human doesn't always get it, whether they're the person who's the patient or they're the human who's taking care of an animal. I think that's the most important point, is you're doing it because you care about the person, or if you're a veterinarian, you care about the animal and you want them to have a healthy life. And you're not doing this for other reasons. So just when you're calling, make sure that you're finding out how they're doing, build a relationship, get friendly with them, find out what's happening, what is their concern about coming in for their next appointment. Sometimes it's money and they don't want to tell you that, but more often than not, it wasn't important enough to overcome any money issues. And I think that would be more the point. So, keep that care factor. And I think that's the key thing when you're doing the call, and really dig in and build a relationship with the person and find out what is going on and how you can help them. And did they understand why they needed that service and that sort of thing, and clarify, because chances are they weren't educated well enough to actually really want that appointment. So now you're trying to overcome that while you're on the phone. So it's just a matter of getting in touch with them and talking with them. Okay, so that's my suggestion for today.